no problems of replacement of joint, life of joint implant. Whereas we used again a similar composition, but every patient had a different frequency of application, different ratios, stem cells counts were different, as well preparation of PRP was different. Along with that, there are light therapies were used, like physiotherapy, which was very compulsory for all of this patient. And if you see after 6 months of the joint spaces come back, cartilages come back, capsule becomes quite strong, ligaments become strong with the healing factors, and the result, the joint becomes at least 15 years younger than what is his age. This is a case of muscular dystrophy. I understand we cannot cure as on date any kind of dystrophies, but at least we can improve the quality of life by increasing the life of myofibrils, saving them from getting into atrophies. Before treatment and after treatment, the showing purpose was that the boy was climbing with holding the railings. He was pulling his body while, and after the treatment, he could walk, climb up the complete staircase without any support.
Specialist in stem cell therapy.
First, to listen to this and I'll explain this
My
very
problem
quickly.
was COPD emphysema. So when I came out, my breathing had deteriorated really badly. I discovered stem cells. So I read a lot about stem cells. I researched where stem cells were available. Then I could provide stem cell therapy for me to improve my lung function. And so I came across Dr. Mahajan's web, and I looked into it, and I made representation of myself to this hospital. And over a period of a few months, I decided that this was the place where I really wanted to come and have stem cell therapy, because I was very confident with the way that the...
I'll just explain about this patient in brief, though the video was not recording, was clear. He was a patient from Australia with severe COPD with emphysema. He was unable to climb even one staircase of floor. He used to hop, even used to. His 6-minute test, if you see walking this type, he was unable to complete. Within 1 minute, he used to get breathless. We did a very specialized protocol for him using nebulization of platelet concentrates and concentrate of the bone marrow. At everyday interval for at least 1 month, an intravenous dose was given this patient. At the end of 2 months, this gentleman could climb 2 floors without hopping. That is a great achievement for us, where he could complete his 6-minute walk test without any getting breathlessness. We also did a assessment with his lung function test, the improvement in the various factors of lung function test. So when we look around application of stem cells or regenerative medicine, we look how broad spectrum we can cover a number of diseases. When we started with one disease. Today we have covered at least more than 70 diseases, very good results. The ratio of difference of getting a benefit is different from different conditions. Orthopedic conditions gave us wonderful results. Autoimmune also gave very wonderful results, but the dose requirement was repeatedly to be given in such cases. And many other conditions where the quality of life was improved. In skin conditions, we got very good results. Now, when we talk of revamping of regenerative medicine, at the base level, when we could get so wonderful results, if the stem cells we combine with scaffolds and enabling technologies which are coming in future, like nanogenetic, all those if we put together, we can cover up the umbrella where almost every disease can be treated, which as on date with proven therapy and spending billions of rupees, still we don't have solutions. Dear friends, this is a breaking healing force, is a breaking medical medical breakthrough, one of the best taken place in the last century. That is the reason this Michael Gurian, who is an AV scientific reporter at the turn of century, he clearly mentioned, I have thought a lot about stem cells, and I'm sure that when historians look back at 20th century, the greatest scientific achievement will not be from the field of space technology or computer technology, but will be from the tissue engineering and genetic medicine. He hadn't said anything wrong. That future is coming up where we can have a gracious life and very healthy aging. So trust me, this is a tornado. Regenerative medicine is a big tornado. A tropical storm which will wipe away the collapsing healthcare system as of date and give a solution to most of untreatable conditions. Before I close my talk, hope and dream for stem cells. We live in a time where the words impossible and insoluble are no longer part of scientific community's vocabulary. Each day, we move closer to trials that will not just minimize the symptoms of disease, but injuries, but eliminate them. Everybody knows Christopher Reeve, the one who was a Superman, ultimately having paraplegic after cervical injury, died 5 years before, 7 years before, had a big hope with stem cells to get back to normal life. Unfortunately, the technology was not then developed that much, but he has given a legacy to all of us and persons like him who are suffering to give a life again to come out of pains. Thank you, my dear friend. A carry-home message for all of you. You carry your repairing kits in your body. Please don't search here and there for the medicine. It is into you, you are carrying it.